Hello, I'm Dr. Jiang-Woo Kwan, a neurosurgeon at Wooridul Spine Hospital. Today, we'll take a look at the differences between two of the most common spinal conditions, herniated discs and spinal stenosis. While hospitals can provide an accurate diagnosis and treatment, it is very important for patients to understand what condition they have and what its characteristics are. Many people confuse these two conditions, but they have different causes, symptoms, and characteristics. If we look at a model of the spine, a herniated disc occurs when the disc between the vertebrae bulges out into the spinal canal and compresses the nerves. In contrast, spinal stenosis is caused by a narrowing of the spinal canal, the pathway through which the nerves pass, due to degenerative changes such as thickened ligaments, bones, or discs pressing on the nerves. In herniated discs, the disc typically herniates to one side, compressing a nerve root. This often results in sudden, severe pain and radiating pain down one side of the body. In contrast, spinal stenosis is usually caused by generalized degenerative changes in the entire spinal canal. Therefore, it can cause pain on both sides of the lower body rather than just one. With herniated discs, the compression usually comes from the front of the spinal canal, so symptoms tend to worsen when bending forward. With spinal stenosis, the compression comes from the back due to thickened ligaments, so pain typically worsens when leaning backward. Herniated discs do not usually cause worsening pain while walking. Symptoms tend to flare up with excessive movement rather than walking itself. In spinal stenosis, however, patients often experience neurogenic claudication, meaning pain that worsens after walking a short distance. Some patients with spinal stenosis report that they need to stop every 100 meters due to severe discomfort. This is one of the most distinguishing symptoms. For herniated discs, the main goal is to remove the herniated portion of the disc. There are several ways to do this. At Wooridul Spine Hospital, we commonly use unilateral endoscopic discectomy, or biportal endoscopy that approaches from the back. If the disc is severely herniated and difficult to remove endoscopically, microsurgical discectomy may be necessary. If the herniation recurs frequently, spinal fusion with pedicle screw fixation may also be considered. For spinal stenosis, the goal is to decompress the narrowed spinal canal. This can be done via biportal endoscopic decompression or microscopic decompression. Thickened ligaments that have lost their function are removed, and we also perform a procedure called spinal ligament reconstruction, which is one of our most common treatments. In severe cases with significant disc degeneration, fusion surgery using screws may also be needed. Ultimately, the most important thing for both conditions is to slow down spinal degeneration and maintain a healthy spine. The key to prevention is proper posture. In addition, core strengthening exercises and regular walking are very helpful. You can find detailed exercise guides on the Wooridul Spine Hospital YouTube channel. Weight management is also critical. Excess body weight increases the load on your spine, accelerating degeneration. Early diagnosis and treatment are essential. By paying attention to the differences I have explained, if you develop these symptoms and seek prompt medical care, the chances of needing surgery can be greatly reduced. We've talked about the differences between herniated discs and spinal stenosis. I hope this helps you better understand which condition you might have, its causes and symptoms. This has been Dr. Jiang-Woo Kwan, a neurosurgeon from Wooridul Spine Hospital. Thank you.